Who wants, this is kind of a survey, more suffering, more disease, less function, less life? Anybody? Just want to make sure you're in the right seminar. Okay. Who wants this? More energy, more health, more time, more purpose, and of course, more fun. Now, show of hands, just one time. Who wants that? Good. Who just didn't know how to use their hand? Good. Now, look at this time. This is not a new concept. I've been around since 1993 practicing. This is the third clinic I've built. They get bigger every time. Okay, don't have three. This just gets bigger because, of course, more people are asking the same questions. My clinic, and originally when I started, it was on heart disease and cancer, because that's all I saw was breast cancer patients and heart disease, because my dad had a heart attack and my mom had breast cancer. But this clinic now has been driven by the needs of women, because let's face it, most women will come into a doctor's office, and if you don't tell them what they want, they will go down the line and keep finding the answer. So it's best you give them the answer, because they won't find it. And that's what I really appreciate about women, is that they will find the answer. They look, they ask questions, they go through it. Us guys, sometimes we suffer a little bit before we go in. So how to live to be 100, I can say that, right? Because I'm a guy, right? Okay. So from 1 cell to 100 million cells. There we are, there we are, there we are. Little baby, that's all cute, right? Okay, and then there. Hopefully there's a little longer of a time in there. Now you can age like that, or you can age like that. It's a big difference. So all of our body ages. Now these are classic words. We hear this word menopause. And I have to watch it, because I'll go up to females and I'll say, what are you doing about your menopause? And they'll say, well, I went through that years ago. Well, the bottom line is you never go through menopause. Menopause is just a name to describe when you have the absence of a period or menses for 1 year. That's all it is. And you kind of get stuck in these names, just like diseases are only names of groups of symptoms. But a lot of people say, well, I have this because I have menopause, or I have this because I have irritable bowel. Well, they're all just groups of symptoms. And I want to give you an idea. So menopause, for instance, is the absence of estrogen and progesterone, and we'll talk about some other hormones. But andropause is the absence of testosterone in guys. Then we have all these other pauses. And all these happen at the same time, roughly. So you age not equally, but uniformly. And you're always as young as your oldest part. You're always as young as your oldest part. In other words, we kind of age, wear and tear ourselves, but where we feel it happens to be the organ system that is the weakest at the time. 50% of the time, it's usually cardiovascular-wise. So somatopause means a decrease in human growth hormone. Electropause means a decrease in the actual activity of the brain. Cardiopause means a decrease in the ability for the heart to pump efficiently. Nephropause, a decrease in the ability for the kidneys to get rid of waste and toxins. Hepatopause is the decrease in the ability for the liver to actually get detoxify. Thyropause, a decrease in thyroid function. All of these are happening to every one of us at some period of time, and also at some type of level or speed to them. The idea is we constantly degrade, we constantly have deficiencies, and we constantly always are in a state of repair and damage, repair and damage. And you can imagine that eventually we all die, right? But you don't want to have to suffer all the way to the end. You want to make sure that your body's repairing as fast as you're damaging. And that's the whole idea. Anti-aging medicine, or healthy aging medicine, really means that we're going to actually help your body repair the most efficient way possible and remove the obstructions that are keeping, right there's one, remove the obstructions that are keeping you from being the healthiest you can be. So the earliest symptoms of aging are, this is way before you ever have a test that says abnormal. If you're not waking up feeling refreshed, feel like you didn't sleep. If you have a low dip in the afternoon around 2 to 4. If you crave sugar or ice cream. Trouble falling or staying asleep. Fatigue or low energy. And a lot of people actually, low energy happens so slowly that people will say, that's just normal for my age. And they'll compare it to their coworkers, and of course, all the coworkers are in the same position, so they don't notice it until they get their energy back. It's very common for a patient to come in, and once they start getting energy back, they go, I didn't even know I had low energy until I got it back. Now, if you have any one of these symptoms, you would be considered to be aging faster than your genetic potential, most of the time with this. And that's way before you're going to show up abnormal. And energy is a great marker. Energy, because you can't fake good energy. And anyone will tell you, if your energy is getting better, that usually means you're getting better, no matter what you're coming in with. Earliest finding of aging, as far as testing goes, is a progressive decrease in all hormones. Progressive elevation in cholesterol. You see this more so in females. The first 5 or 10 years before a female goes through menopause, her cholesterol will start going up, because we'll talk about that later on, but cholesterol is actually a hormone. And it makes sense that the body never does anything stupid on purpose. It wants to live, and it wants to survive, and it wants to help you out, and it wants to serve you, and it doesn't have the program that says, you know what, you really bothered me yesterday, and I'm going to actually kill you early. It doesn't do that. It's your best friend all the time, every time, and it's doing the best it can under the circumstances that you place it into or the environment that it's exposed to. But this cholesterol is a compensating mechanism by your body to try to save you, because in menopause, hormones go down, and cholesterol goes up because cholesterol actually helps make hormones. Blood sugar imbalance, decreased muscle mass, decrease in lung function, which basically means you feel like you're huffing and puffing upstairs, decreases in energy, increases in body fat, usually around the midsection. The average female through menopause, 5 years before menopause, gains 20 pounds of weight. And it's the worst weight to gain because it's the inflammatory weight. Guys gain it differently. You can have guys that are relatively thin and have just a little bit of a belly in the front because they gain weight at different areas, but it's still equally as inflammatory and equally as toxic. You're going to hear me say that word a lot, inflammation, inflammatory. Decreased digestion. The worst thing you want to have is you're taking nutrition to try to heal your body and you're not even assimilating it properly. You're just letting it all the way through. All of these are signs, again, that you're aging faster than you should, or that there's something wrong. Now, if you ignored all these signs, again, you would go to your standard medical doctor, just your standard one, not your one who's trained in healthy aging or anti-aging, but your standard medical doctor, and there's no test for these necessarily that says you're sick. They would say that's just normal for your age, or you're not sick enough to get the test. And unfortunately, and we love Canada, I love Canada, but unfortunately sometimes you have to be sick before you get a test. Like a person has to break a hip, a female has to break a bone before she can get a bone density. And that's really kind of ridiculous. So the government does not pay for prevention, just so you know. You have to be sick. It's not good or bad, up or down, just what is. So you see all these diseases? These are 90 to 95% of every disease fits into those. If you ignored those symptoms that were just on the last page and you kept on going with them, eventually you would have earned and inherited and worked hard to get these diseases, these names. Because they're really almost all the same thing. They're just different areas of the body that are affected. And a lot of times they're overlapping anyway, like heart disease and diabetes are usually over-affecting. A problem with cardiovascular system and a problem with blood sugar, they're hand in hand 50% of the time. New England Journal of Medicine, the overall deterioration of the body that comes with growing old is not inevitable. We now realize that some aspects can be prevented or reversed. And that's a good thing. What the bottom line of that statement is that I have some power. I'm not just programmed to my destiny. I'm not just programmed my genetics. Just because my dad had heart disease, there's a genetic predisposition, but it doesn't mean I'm going to get that. And by the way, just so you know, from the Genome Project, they now know that genetics aren't as big of a play as they thought in disease development. And I mean chronic disease development, which is 90 to 95% of all diseases. It's about 20 to 30%. That means up to 70 to 80%. How you actually age and how much health you have really depends on you, your choices, and the environment you place your choices into. So how do we age? Let's take a look. As genetics, we talk about, here's the world we live in. Genetics, okay, 20 to 30%. Diet, even if you had a perfect diet, okay, you would still get exposed to some toxins. Anybody remember those 4 or 5 politicians that got tested for toxins? Everybody? About 5 years? Sorry, about several months ago? Well, I believe they measured them for around 180 toxins. And each one of them had an average of around 100 different types of pesticides. Some of them were hormone disruptors, which means they actually mimicked hormones, but in a negative way. Now, that's pretty hard. These were 4 standard people. And in fact, the average person, from different articles I've read, has 500 different types of pesticides floating around their body. And it usually traps in fat. Fat happens to be the reservoir where toxins are stored. So if your body can't get rid of fat, or can't get rid of a toxin, it just puts it to the fat tissue. Now that's dangerous, but also even more dangerous if someone's trying to go on a weight loss program and they're going ahead and they're trying to lose weight, and then the toxin gets released from the fat tissue, but they don't have the ability to detoxify it. So of course the body trying to live just makes more fat to put the toxin back in. That's what I talk about in the weight loss. So diet, again, toxins. Sugar, the average person eats 140 pounds of sugar per year, and genetically, you're not supposed to really have any. Okay? Allergy reactions, every one of you, if I tested antibodies against dairy, wheat, and eggs, 90% of you would have an immune response, antibodies or soldiers floating around for those things. That means that whenever you eat those